Amidst the COVID-19 pandemic, people around the world had to adjust to the new normal with unforeseeable consequences and outcomes. As the fatal virus spread through the air, people were isolated at home with limited social contact. Masks were required as the public rushed to the grocery store and bought as much toilet paper as possible. Schools were closing as students' learning plateaued and virtual learning became second nature. Businesses took a toll as millions lost their jobs, creating the largest unemployment rates and an increase in global poverty. Mental illness increased as 30% of adults were experiencing anxiety or depression symptoms. During the pandemic, fear was a consistent emotion as the public was unaware of the consequences of the pandemic. As of June 2022, approximately 14.9 million people around the world have lost their lives due to this deadly virus. People were used to unmasked in-person social encounters and facial expressions. When the pandemic struck, people found it difficult to adjust to the endless social, economic, cultural, mental, and physical effects. On a worldwide and individualized level, people are still recovering from the devastating and long-term changes due to this pandemic. As the pandemic impacts everyone's lives in different aspects, many professions were altered. Some lost their jobs. Others were able to work remotely from home, while others were needed to fight COVID-19 head-on. Many healthcare professionals were at the forefront as vaccines needed to be created, masks needed to be safer, and millions needed treatment to beat the virus. Although there was fear, healthcare professionals continued to show up each day and care for those infected with the virus. Those on the forefront, especially healthcare professionals, started getting notable recognition for facing the pandemic head-on from their communities. Times Magazine issued magazines titled Heroes on the Front Lines, linked in the comment section of this video, describing the courageous stories of those who worked on the front lines during the height of the pandemic. Those who sacrificed their lives to help patients who were strangers to them, but someone else's mom, dad, grandparent, child, or loved one who was fighting for their life, alone. Healthcare professionals were challenged to step up with compassion to care for the most vulnerable during the hardest times. They were recognized as heroes. Marvel partnered with Allgeyer Health Network to honor these selfless workers who cared for our loved ones when we were unable to fight with them. Marvel inaugurated their newest heroes, nurses, who went through physical and emotional hardships amidst the pandemic out of compassion, love, and commitment to their duty. Marvel issued a comic book titled The Vitals, True Nurse Stories, containing real stories by nurses of Allgeyer Health Network to honor our heroes. As the pandemic continued, those in healthcare, especially nurses, got extremely burnt out due to constantly being on the front lines of the pandemic. New nurses are being recruited as the nursing shortage increases and nurse-to-patient ratios are skyrocketing. New technology and policies are being created and implemented as the pandemic has changed the view on healthcare in the future. The COVID-19 pandemic has impacted nursing due to rapid and vast changes within the community and long-term impacts on the profession. The pandemic caused a shortage of nurses, creating an unsafe ratio of nurses to patients. Many nurses were getting burnt out due to extreme stress within the profession, including longer shifts with worry about the pandemic from patients and staff. Additionally, many nurses were exposed to COVID-19 and died, or gave it to loved ones who also died. In a study, healthcare professionals have experienced more concerns about their mental health during the pandemic. The increase in stress and secondary trauma from watching patients die due to an unstoppable virus took a toll on nurses as many nurses left bedside care, causing staffing issues. In all my interviews with nurses, each nurse mentions that nursing burnout has been a cause of staff shortage during the pandemic. The pandemic also heavily impacted education, as most students were forced to learn online due to social distance limits. Students studying hands-on courses suffered the most. Students were unable to study in the lab, and clinical rotations were interrupted. Many students felt unequipped and reluctant to use their skills in the workforce due to limited practice in the classroom. In addition to hands-on learning practice being interrupted, the admissions process of nursing schools was also affected by the pandemic. More students applied to nursing programs. According to a nursing journal, 2 nursing schools in New Jersey had 380 and 800 applications for 90 slots within the school. While these nursing schools and other schools were getting hundreds of applications from eager nurses, these schools do not have enough classroom space, faculty, clinical connections, or equipment to educate the high demand of nurses the pandemic acquired. The pandemic has left devastating yet beneficial impacts on policies and technologies within the profession. Nurses have to be flexible throughout the pandemic as changes were constantly being made to benefit the public. The first change in protocol in patient care was the boost to increase social distance and hand hygiene. Following was the mask mandate and increasing use of personal protective equipment. These protocols have caused healthcare professionals to lose their genuine connection with patients. Many nurses report that it is hard to provide patient-centered care with the barrier of a mask blocking the emotions and empathy of a connection. Many felt as if the pandemic increased the anxiety of the public going to the doctor due to the loss of connection. As more health regulations were enforced, the lack of trust in medicine deepens. The pandemic has caused many to mistrust medicine. While these policies have crippled the nursing profession, many technologies have been created to advance medicine. For example, IV pumps were able to be monitored outside of a patient room to reduce social contact and the use of personal protective equipment. Nurses created ways to safely administer IV fluids to critically ill patients while reducing social contact. In addition to in-hospital advances, telehealth became a booming industry. Hospitals educated and encouraged healthcare professionals to use telehealth to connect with patients virtually. COVID-19 has affected every life on this planet in one way or another. Nurses rose to the plate, endured stress, adapted to their new environment and policies, and continued to provide patient-centered care with courage and devotion to their careers. After finishing my first year of nursing school, it is important that I am aware of the effects COVID had on my desired career. Amidst nursing staff shortages, the risk of contracting the virus, adjusting to online learning, acquiring new policies, educating patients on new procedures, discovering and utilizing new technologies, and putting in the extra effort to gain trust, nurses never stopped caring for their patients during this time of uncertainty. I want to pursue a nursing career where I am challenged to adapt and provide excellent care to each and every patient. I want to inspire others the way nurses exhibited by courageously battling COVID-19. I want to be the hero. In June of 2022, it has only been approximately 2.5 years since the start of the pandemic in December 2019. As time continues, the mutation of the virus has become less deadly and more preventable. With the creation of Pfizer and Moderna vaccines, the public and healthcare professionals can safely protect themselves against this fatal virus. While the spike of the pandemic has already occurred, it is still being transmitted and contracted around the world. As I enter the workforce, it is important to remember that further research must be conducted to discover and determine the long-term impacts the pandemic has endured on society.